I had this wonderful baby shower. People came to visit me the first 2 weeks of the baby. Now everybody's gone now. What? Hello, lovely people. Welcome to my virtual couch. Happy Friday to ya. So I don't even know when I'm gonna drop this video. So I don't know what my last video is, but whatever last video that I did is gonna be up here or elsewhere. Anyway, all right, so we're gonna talk about postpartum depression and postpartum anxiety. Postpartum depression and postpartum anxiety is one of the conditions that I really like treating because I really like working with mothers because I'm a mother myself. And let me adjust this. I really like working with mothers because I'm a mother myself. And I like to, when mothers come to me, they think they're going crazy. They feel alone. And when I tell them that postpartum depression and anxiety is treatable, and that's my job to help them treat the condition, I literally see the hope in their eyes. So postpartum depression and anxiety is a condition that I really like treating, I will say. I also do run a postpartum support group of newish mothers. Actually, no, I have a mom in my group who has a 2-year-old. And we talk about all things motherhood, the challenges, the struggles. And that's something that, if you're struggling with postpartum depression and anxiety, even though there is shame surrounding it, being in a group setting can also help. And it's a virtual group, so you can turn off your camera. And I make it very flexible. Like, hey, if you need to bring your baby on camera and nurse your baby, whip out your boob, who cares? So let's talk about postpartum depression first, okay? So in a nutshell, postpartum depression. Some people might say, well, what's the difference between having baby blues and having postpartum depression? Well, the difference is that it's the length of time. When you're having baby blues, it's something that is a short term. But however, postpartum depression lasts a while. Postpartum depression can even last up to a year in some extreme cases that we've seen. In a sense, what is postpartum depression? Okay, I've had the baby. I was pregnant. It was great. Or maybe it wasn't that great. I had this wonderful baby shower. People came to visit me the first 2 weeks of the baby. Now everybody's gone now. What? My husband's gone back to work, or I'm a single mother, and now what? Okay. So postpartum depression, what is it? I'm having difficulty sleeping because insomnia comes with childbirth. I have no energy, right? Which obviously comes with having a baby. I have low sex drive. I have changes in appetite. I'm either losing a bunch of weight or gaining a bunch of weight. I have guilt and fear and sadness of being alone. I feel like my baby might be better off without me. I'm having scary thoughts about the baby. I am thinking that the baby if the baby sleeps, at night, the baby's going to die. I have hopelessness. I don't enjoy the things that I used to. I'm having difficulty concentrating. I'm having impatience. I'm irritable. I'm moody. I'm just not pleasant to be around. In a sense, that's postpartum depression. I try to make it into as simple terms as possible. Okay, so that's postpartum depression, and it lasts a while. And sometimes you may not even realize that you're having it because, again, when you have a baby, you are in survival mode. You can have all the support system in the world, but as a mom, you are in survival mode. Also, you still have hormones from pregnancy. The hormones don't disappear with birth, right? And I love a saying that I say to my moms, which is you don't start to feel like yourself until a year. Keyword is start until a year, right? But basically, you don't want to be around anybody. Just leave me alone. I'm going to figure this out. I'm not eating. I'm not sleeping. I hate life. I hate you. I hate me. I hate everybody. And sometimes some people even have trouble connecting with your baby or bonding with your baby. Like, I know I was pregnant. I had the baby's here, but I just don't feel connected. But I'm scared to say anything because I don't want people to judge me. There's shame around it. People are going to look at me funny. So I'm just dealing with it. That's postpartum depression. How is postpartum depression diagnosed is, well, if you go see your doctor. So typically when you give birth, right? If any males are watching, they don't know. If anybody's watching, they don't know. You have to go see the OBGYN 6 weeks after giving birth, right? But primarily that visit's to make sure that everything's good down there, yada, yada, yada. You know, but the baby has to be seen within a week. I think like 3 days. I forgot. I think my son was seen like in 3 days, right? But the problem is that when you go see your OBGYN, you're talking about your hoo-ha, you're talking about your body changes, but a good OBGYN assess you for postpartum depression because postpartum depression is very common. 1 in 7 mothers experience postpartum depression. So you might have people in your life experiencing postpartum depression and don't even realize it. Okay, so that is the time to be honest with your provider. Sometimes some providers will even give you a checklist when you go for your 6 weeks. Also, here's a thing that I like to encourage mothers to do. Do not wait until 6 weeks to go see your doctor if you feel like you're experiencing something. Listen, the baby has to be seen within 3 days. If you are feeling some type of way, do not wait till 6 weeks. See your doctor within a month of giving birth. You just have to, because by the time you wait 6 weeks, your symptoms might have been exacerbated and it might be worse. Okay. How do doctors screen for postpartum depression? Usually there's a checklist. Usually there's 10 questions that it will ask you. And if a majority of it is yes or always, chances are you have postpartum depression. There is no known cause of postpartum depression, but what studies have shown is the rapid drop in hormones after giving birth might be a cause. Even though all the hormones doesn't leave your system, there are drastic changes and chemical changes, social and psychological changes that also contributes to postpartum depression. A lot of mothers, if they feel like if there's a lack of support, either intentionally or unintentionally, and they don't communicate their needs, that can contribute to the depression. Sometimes as mothers, we feel like we have to be superwoman. We feel like we have to do it all, so we don't ask for help. We're not direct about what we need, and that can contribute to postpartum depression. That's something that I had to learn, is I had to be vocal about what I need, right? Because your spouse, your family member, they're not mind readers. You have to be vocal. Okay. So what are the treatment of postpartum depression? Well, a couple of things. Postpartum depression is treated by either medication, but sometimes some mothers are like, I don't want to take medication, I'm nursing. You have to talk to a good psychiatrist who's going to say, these are the medication that is used to treat these are good medications that you can use while you're nursing. In addition, going to therapy, talk therapy, just talking about the changes that you're dealing with as a mother, talking about the transition, talking about the feelings of anxiety in a woman, just talking it out with the professional that's not going to judge you is very helpful. Group therapy, as I mentioned, I run a support group, and the women feel good knowing that I'm not in this by myself, right? My family member is not going to understand because they're going to say, oh, when I had a baby, there was no such thing as postpartum depression. Oh, well, it'll pass. Oh, pray on it. Oh, and there's nothing wrong with prayer, but sometimes we need more than prayers. God made doctors and therapists for a reason, right? So in severe cases, which I did in another video, postpartum depression can even lead to postpartum psychosis. Now that's when you are in the danger zone, you're in code red. And I have another video talking about that. Okay. The most misconception is women feel like I'm breastfeeding, so I can't take medication. That is false. Find a doctor that will give you a low dosage of medication that is safe. And also, this is the time where you utilize your support system. So if you have a support system, you have a meeting with them and you say, hey, look, I need help. I need someone to come watch the baby while I go for a walk. I need somebody to come watch the baby while I get some rest. I need someone to help me to help myself. A lot of times mothers feel like, I've lost a lot of things being a mother. Like it's wonderful being a mom, but maybe I used to like to run and I can't run anymore because I'm with the baby, or I'm with the baby all day. I don't have any human contact, right? So having a support system that's going to come and having a plan also helps with postpartum depression. Now let's talk about postpartum anxiety and the difference between postpartum depression and postpartum anxiety. Postpartum depression and postpartum anxiety can overlap. The difference between the two is postpartum anxiety is excessive, uncontrollable, irrational anxiety in the months before and after giving birth. Right? You're excessively worried to the point where it is affecting your functioning. It is irrational. Postpartum anxiety is when you're having racing thoughts, right? And it's keeping you up at night. It's keeping you distracted. You are constantly in a state of intensity of worried. You're always feeling like something bad is going to happen to the baby. To the point where, again, you are disrupting the baby, or you are disrupting the functioning, okay? You're not able to sit still, right? So with postpartum depression, you may feel low and down and you may not want to do anything. Postpartum anxiety is very common. What are the causes of postpartum anxiety? Same thing, hormonal changes, changes in the brain during pregnancy, dealing with certain stressors like lack of support. I have found that postpartum anxiety usually start in perinatal. So when the moms are pregnant, the anxiety begins then, and then it exacerbates when they give birth. So it starts in pregnancy and it worsens in postpartum. So it's really, really important. Like if you have a family member that's pregnant or has given birth, to be on the lookout, because having the baby can re-trigger or exacerbate the anxiety. Mothers sometimes also experience an onset of OCD after the birth of the child. So before, you didn't have OCD symptoms, which is obsessive compulsive disorder, but now that you have a baby, you have developed obsessive compulsive disorder symptoms. That's a part of postpartum anxiety. Okay. So treatment for postpartum anxiety, the same thing as postpartum depression. Therapy, consulting with a psychiatrist, having a plan with your family, using cognitive behavioral therapy approaches or dialectical behavioral therapy approaches is important. Having a healthy lifestyle, so eating right, resting, exercising, and socializing. Call a friend, hey, can we go for a walk? Hey, can you come over while the baby's asleep? I just need a human contact. Sometimes mothers, you're with the baby all day, right? So you're like, I need some human contact. Sometimes mothers will say to me, so what do I do all day? I mean, I have this baby here. The baby doesn't talk. The baby's not doing anything. The baby's just sleeping and just waking up. Is this all there is right now? You know, so there's that, and there's the grief. There's a grief of your old life. Like, I wanted this, but now that this is here, how do I manage this, right? So that's very important. Both conditions are treatable. That's what I like to tell moms. It is treatable. It might take a while to treat, but it's very treatable and it's temporary. So finding a therapist that specializes in any postpartum issues is very helpful. I hope that you found this video helpful. Let me know if you have experienced any postpartum issues, if you know somebody experienced any postpartum issues, or you just simply don't know what to do. Leave a comment. Please subscribe. Thank you for your support. See you later. Bye.